Hello, I'm Dr. Dennis McKenna, and welcome to another edition of Inside Albany Med. And I'm so pleased today to be joined by Dr. Stephanie Dosick. Great to have you here, Stephanie.
Thank you. Glad to be here.
I've been looking forward to this for a while. And let's begin by, first of all, your title, doctor. Tell us, you're a PhD.
Yes.
Tell us what your background is in.
So my degree is actually in geology. I did geology for undergrad, and then in my PhD, I studied fossil whales. So trying to figure out the diet of ancient whales.
The diet of ancient whales, and yet you find yourself inside here at Albany Med. So tell us what kind of brought you in here, and then obviously give us a chance to talk about the important work you're doing in your department.
Yeah, absolutely. I think the thing that led me here was education. Right. So I've always been really passionate about education. I've taught in a lot of different schools in the region, right, and a lot of different courses. And I think the other part about education that I really like is education in non-traditional settings. Right. So one of my favorite jobs was actually, I was a park ranger at Jewel Cave National Monument.
Fantastic.
In the Black Hills of South Dakota. And it's just such a wonderful opportunity to teach a variety of people in a really non-traditional setting. And that is the sort of thing I really enjoyed. So I came to Albany Med 6 years ago to run the educational programming for what we called the BAC, the business incubator at the time. And it was really that education focus that drew me in. And then the more I learned about commercialization, right, and translational research and all of that, I just really enjoyed it. As a PhD, they say you get very good at learning.
You should. Isn't that great? Because people often think the learning has ended, but really the learning, it continues.
Yeah, and that's what I love. I love to learn new things, and this job really offers a lot of opportunity for that.
Now, this studio actually is in the same building where you work. If we came out the backside of the college, people are familiar with where, say, the ME auditoriums are. People may look at this building we're in and say, I wonder what goes on in there. So this is the Office of Translational Research. That's the short name.
Yep.
What's the long name?
The full name is the Office of Translational Research, Innovation, and Technology Transfer.
And you were saying earlier that one of the things that you love about your job is that you sit at the middle of our tripartite mission, right? We're an academic medical center. We do education, we do clinical care, we do research. And you sit in the middle of all three of those.
Yeah, translational research is really interesting because there's a lot of different ways to define right, it, but at its core, it's trying to get those novel, innovative research ideas and move them out of research and into the real world to improve patient experience, provider experience, right, in a variety of ways. So that's what we're trying to do, to take these brilliant ideas that our researchers, right, and clinicians have and make them a reality.
So every time we are doing something clinically in our area of expertise, whether it be the OR or the emergency department or the ICU or at the bedside, we use various scopes or tools or devices that at one point started in somebody's head, right?
Yeah.
And today at Albany Med, we have people of all levels, students, learners, senior physicians, nurses, pharmacists. They have these wonderful ideas, right? They're like, I bet we could do this better.
Yep.
That's when they come to you and say, I have an idea.
Yeah.
Basically.
Yeah, and then we get to work with them and figure out, what does this idea look like? What would a path forward look, right, like? What kind of partners do we need to identify? Right. Should there be a patent surrounding it? We're kind of helping that whole process and also connecting them to the right, resources that are available regionally. Our region has a very nice entrepreneurship and yep, commercialization ecosystem. It's right, statewide, but we're biased, but I feel like the Capital Region has a very strong sort of group of support organizations. And so there's lots of programming, there's right, lots of support, and we can help connect people.
I think most people probably don't appreciate that of the products that become successful, it's probably the minority, right, of ideas that are brought forward. But there's also value, I assume, in saying, hey, that's a good idea, but it's already been done. Or that's a good idea, but here's the problems you're going to have. And you'll probably have other good ideas in the future, so maybe go work on those, but this one doesn't work. Is that also true?
Yeah, absolutely. We see a lot of people who come with one idea, right, and they start working with it and they realize, right, usually through talking with customers and what's called right, customer discovery, right, this isn't actually solving the real problem. Right. This is the real problem. And right, if I do this instead or change it in this way, it'll have a bigger impact.
Are some of those ideas that people have thought about, brought to you and your team, are those ideas now being trialed inside the hospital or on patients here? Is that part of the reason why it's great to have the translational research occur on a campus where there's a hospital and patients?
Yeah, absolutely. So we're working with a local startup, for example, called IsoGuardian.
Okay.
And they are developing a reusable fabric gown that's manufactured here in New York State. It's more comfortable, it's more secure, it prevents leakage and fluid. We're looking to trial their first design for it in one of our departments. So we're working with all sorts of different departments to figure out how to do that.
Do you see your job often as a connector? Right? So in other words, you're dealing with supply chain, you're dealing with materials management, you're dealing with clinical people, you're dealing with procurement, finance. You have to probably figure out all the people that need to be involved in a project like this.
Absolutely. And that's, I think, one of the biggest strengths of our department is that we have a lot of connections inside Albany Med and also outside. A lot of what we do is just connecting people with other people.
Now, these videos, they're seen by millions of people, maybe thousands. If they're seen by someone here at Albany Med, whether they be a student or maybe someone who works on the floor, and they say, "Oh, I do have an idea." Like, what should they do? Like, what's the best way to reach out to you? Just to say, where do I go with this idea?
Yeah, absolutely. They can reach out directly to me. We also have a general department email that is techtransfer@amc.edu.
So let's say it again, techtransfer@amc.edu.
Yep.
And is there also a place on the intranet where they can go and look for information?
Yes, so there is a spot for tech transfer that has all of our forms, including our patent policy and how to do that. But it can be confusing. It's a lot of information. So we're absolutely happy to have a phone call or a video call or a meeting to just go through the process. What is it like? Are you ready for it? Because sometimes you're too early in the process and it's not worth the time to fill out all the paperwork if you're not far enough along.
Is there another success story or two that you might want to highlight of products that you've seen that have come through this process that are in different stages of development?
Yeah, absolutely. We've had a couple of med students who have come to us. We had one student several years ago, John Moon, who graduated in 2020, and he had an idea for a novel catheter. And he worked on it here. He formed a company surrounding it, and when he went to do his residency at Emory, brought the idea with him, got support from Emory to continue.
That's great.
And now he's still continuing with it as a physician.
So it started as a medical student and it followed with him. And do you continue to reach out or work with Emory maybe on information? Like, in other words, do we stay involved after they leave here, or does it go with them?
So in this case, it mostly went with him, but we do continue to support. If ever there's something that he needs, we're still supporting him. And he is actually a mentor for us. So if med students have an idea, he's very happy to talk with them about the process that he went through.
All right, so be honest. What's more fun, whale diets of a million years ago whales, or taking steps to improve healthcare in the 21st century?
I do really enjoy the healthcare in the 21st century because as much as I love paleontology and I think that knowledge is super critical, this is impacting people, real people in our community, and it's a very gratifying feeling.
And we don't want to be dismissive of all that work. It is important, but we're certainly glad that you transitioned over and doing the work for us here, because it's great work. I know there's another thing that you're working on, which is boot camp. Boot camp. Can you describe a little bit what boot camp is, who's involved, and what's the purpose of the boot camp?
Yeah, the Bioinnovation Boot Camp is a program that we created to essentially teach the skills of commercialization specifically for biotech or medical inventions. So there's a lot of boot camps out there that'll teach you how to form a company, how to file a patent, basic things like that. But it's very different when you're in biotech. So we try to have everything with a focus on the sort of healthcare space. How do you navigate the FDA compliance requirements? How do you work with health insurance to ensure that it's reimbursable and you can get paid for your invention?
And when is the boot camp going to be?
So we tend to run it every other year. We ran it last spring in 2024 in partnership with Albany College of Pharmacy and Health Sciences, and we're hoping to run it again probably 2026.
And who can come to the boot camp?
The boot camp is for anyone who has an idea.
Not just Albany Med employees or students. We advertise it in the community and others come.
Yep, and we've had everything from undergrad students, graduate students, postdocs, med students, faculty, entrepreneurs. It's a big mix, and that's the real benefit of it. We feel we offer it every other year to make sure that we have a strong enough cohort that they can learn from one another because they're building their network and they need to have people who are experiencing the same thing to work together. And that's one of the things that participants say is so great about the program. It's building a network, having connections, knowing where to go to find answers, and then having that sort of shared experience.
How many people attended last year's approximately?
Last year's we had 15 participants.
Great. So hopefully this year or next year we'll have an equal or larger number as well. That's wonderful.
Yeah, and the boot camp ends with a pitch competition where if you have an idea, you can pitch it to a panel of judges, and you might win some cash and in-kind support to help with early innovation.
At one point, I was going to make a Shark Tank reference. I thought that would probably be cliche, but in reality, there is something like that to the boot camp, and I'm sure that people probably like that opportunity, right?
Yeah, it can be really hard to get those early stage funds to help you with your first prototype or your next step in the design process. And having that sort of support regionally can be very impactful.
One other question I wanted to ask you was about your background, right? So you had mentioned that you have a PhD and you worked on geology, paleontology, I believe. Is there anything that you learned in that discipline that's translatable to what you're doing here today? So we're not dealing with whales, but there is, I assume, some things about the structure and the way in which PhDs think that maybe makes a translation into what we're doing here today? Absolutely.
A PhD really teaches you how to learn and how to critically evaluate information, how to research things. And I find that all of those skills are very helpful in this job. When I'm presented with some cool new invention out of plastic surgery, I have to do a lot of research to learn a little bit more about it because I'm a paleontologist.
That's
so
true.
I don't know it. And so being able to look that information up and know how to, one, get a brief understanding on it, and then two, to understand there's no way to learn everything. And so you have to appreciate what you don't know and be able to find that elsewhere.
And partner with the person who has the idea. You bring certain information, they bring certain information. You dive a little bit deeper probably than you would before you even knew about the product, but then you can only go so deep. They've got to take the clinical, and that's interesting. So it's the way you process data, the way you think, the way you digest that information, logic, obviously.
And the other great thing about geology and paleontology is it's very interdisciplinary. So it involves, a little bit of physics, a little bit of chemistry, a little bit of biology. Lots of different ideas and things coming together. And I think that's very true of healthcare as well. There's a lot of different pieces coming together. So being able to appreciate information from different sources is another really helpful skill.
Talk a little bit about your life outside of work. You're fit, you're active, you like to, I think, bike a lot. Is that correct?
Yeah, that's probably my biggest hobby. I love bike riding, hopping on the Mohawk Hudson trail, or if it's really gross out, I have a bike, a Peloton. So I do spin classes, and I just really enjoy bike riding. It's my favorite sort of exercise.
Have you ever done outside any really long bike rides, like long distances? Are you moving towards maybe being able to do a century ride or something like that?
I don't know. I haven't really thought about it. I did one time just start biking and see if I could get to the Hudson without looking at the map and realizing that the bike trail curves pretty far south before it gets to the Hudson. So I accidentally did like a 30-mile bike ride, but
it is great to be outside, though. That's one of the problems with the spring is that some days it's 70 degrees and beautiful, and the next day it's 40 degrees and raining. We have a lot of people at Albany Med that are bikers. I know some of them, and they often talk about their bike rides. And the Peloton is awesome. If you're fortunate to have one of those, you can get a really good workout there as well. And you mentioned you had a daughter as well, correct?
Yep. So I have a daughter who is 11 and a son who is 9. And so they keep us very busy as well. And we've got 3 cats and 1 dog, so
you're
crazy
busy
household.
And what do they think mom does when she's at work?
I'm not sure that they have an answer for that.
But they'll watch this video for sure.
And hopefully they'll know. I like to tell them my short answer is we help people who are inventing cool new things.
And that sounds pretty good to them. Now, you told us why you came to Albany Med. Why do you stay? Like, what's the reason why you stay here?
I think it ties back to 2 things that we've already mentioned. One, my love for learning new things. So every time someone comes in with a cool new invention, it's a brand new thing for me to learn about. And I really enjoy that experience. And then the other thing is just having that real impact in society and supporting and helping our students, our faculty, our clinicians with their dreams in a lot of cases.
Yeah, and helping them through that process.
Yeah.
You know, I wouldn't be surprised if after watching this video you get a couple phone calls or emails of people who have ideas. I hope that we
hope
do.
so.
That's the reason
Yeah.
we want to do that, right?
Yeah.
And see what ideas they have out there as well. Well, we really enjoy you taking the time to come in and talk to us about the important work in the Office of Translational Research and
Innovation and Technology
Innovation
Transfer.
and Technology. And we certainly appreciate your leadership, your creativity, your enthusiasm, and all the ways in which you're helping kind of spark that creative interest in the part of our learners or our workforce to hopefully bring something to market. So it's wonderful. So thank you very much.
Yeah, thank you.